So we had a patient come in, we'd seen her in years past. She moved a little distance away, hurt herself running, goes to another clinic, and was really unhappy. What she has is a lower leg pain right up on that tibia, a big nasty shin splint. However, the place she went to, she saw two different providers on 2 different days, and they're both focusing on glute and hip strength and stability, doing nothing to the lower leg. Nobody's touched it yet. And at this point, she's like, I'm not going to get better. I'm not going to get ready for my race here in 6 weeks where I'm going to do a half marathon. So she's driving a good distance to come back and get this under control. And I look at that leg, and the first thing I'm worried about is a stress fracture, because it's either a really, really bad shin splint or a stress fracture right along that tibia, and she shouldn't be run on either one, and we need to change plans accordingly. So first thing we're doing is getting imaging. Then we're treating the posterior tib and that shin splint once the x-ray ruled it out. Yes, the glute and hip stability is contributing to her running gait, which led to her overworking that lower leg, which led to this developing. But the order of priorities has to be what hurts first. Rule out the big bad nasty, the stress fracture, get that lower leg under control, and do a little hip stuff on the side so she can finish her race. Well, sure enough, she's now just finished that half marathon, and the thing flared up again a little bit, because we just didn't have enough time to get it all the way better, but she wouldn't have been able to do it if we just focused on the glute part. So as providers, we need to remember, what does the patient want? What are their goals? Get that first, and then work around. As her lower leg is getting better and her balance and stability is getting better, we can really work on that glute and hip strength to prevent this injury in the future, but that's a long-term goal, not the first goal we should be working on.